Hey guys, I'm going to be going through my patient caring presentation, and hopefully it's not too awkward. It might be a little awkward, so I'm sorry. This semester I met with my patient TS one time. During that visit, we updated her medications and filled out her health and wellness questionnaire. We discussed questions and concerns that she had about her medications, which were minimal because my patient is a nurse and she's been a nurse for like 30 years. She's currently retired, so she doesn't do that anymore. She's very knowledgeable about her medications, so that means she's usually pretty open with me about any problems she's been having, and she also can go and find answers herself. But it's sometimes she'll send me text messages and just ask me about different things that's going on with her medicine. So now I'm going to take you through her soap note. Her chief complaint: she complains of chronic back pain, history of present illness. She's 56 years old. She's had quite a few surgeries. She has steel rod in her leg. She's got a rod in her back too. Past medical history: she's got prediabetes, anxiety, depression, arthritis, and hypothyroidism. As far as the medications that she takes, she's on metformin, 500 milligrams for her diabetes, or prediabetes. It's not actually diabetes. She uses a fentanyl transdermal patch, 50 micrograms, one patch every 3 days, 50 micrograms per hour. It's one patch every 3 days. Synthroid, 700 or 75 micrograms. She takes that every morning. Prozac, 40 milligrams every morning. Robaxin, 750 milligrams as needed for pain or for muscle spasms, stuff like that. Hydrocodone for pain, 10-325 every 4 to 6 hours. Asphyx for reflux, Ambien to help her sleep. Sometimes she gets insomnia. Uh, Valium because she has pretty bad anxiety. She's had it for a long time. Miralax, 17 grams daily. That's probably to counteract all the opioids that she's taking. The Voltaren, 1% topical gel. She doesn't use that very often, but she said sometimes she's in a lot of pain and it helps. And that's it as far as the medication. So, as far as concerns about her medication, I really don't have any concerns. She takes a lot of the opioid medications, but she's pretty tolerant at this point. She's been on them for 5 or 6 years. They've upped the doses, but I mean, there's not really anything she can do about that. She's in a lot of pain. I feel like they're necessary for her. She's taking the Miralax to curb the constipation from the opioids. She doesn't have any signs of respiratory depression, even with the benzos and the opioids. Her A1C has gone down since the last time we had met. It was 6.1, and now it's down to 5.7. So the metformin is obviously working for her. She told me that her Prozac was working well too. She said she has less anxiety and less depression. And we had talked about smoking a lot last semester, and she started using a vaporizing pen over Christmas break. And probably I think she said sometime in January she just decided she was going to quit. So she finally quit smoking after about 30 years. So that's really good. And she's lost 10 pounds. So my patient is doing really well, doing a lot better than she has been doing. Um, and as far as what I did for this, I wrote a soap note and I'm going to attach it for you guys so you can all see it. In order to reach the conclusions that I came to in my soap note, I used Lexicomp to determine if the medications were given for the appropriate reasons and at the right doses. I also asked my patient how she felt about the medications she was taking. She felt like they were all working very well, and she really didn't feel like she needed anything changed. So she was happy. I'm happy. That's good. Um, as far as how I feel about having to do these patient caring things, I feel like having to do it for the last 3 years has been really helpful. Yeah, when we first started doing it, I was like, "What's the point of this? It's kind of stupid. It's just another hoop they want us to jump through." But at this point, I feel like I really know how to interact with my patient. I know questions to ask her to get her to talk to me. I can give her the tools necessary to help herself. I know what questions to ask her, when to ask her. She doesn't like to be coddled, and I figured that out. She likes to be in charge of all of her decisions, and I can empower her to do better for herself. And I feel like I've learned how to do that by being her personal pharmacist for the last 2 years. This experience has not changed my thinking. I always knew that this was an important position. More so, it has given me the ability to approach the patient-provider relationship in ways that I had previously not thought about. It has given me different angles to work from. I feel as though this has enhanced my skills as a person because it has made me patient. It has given me the courage to know that I'm competent. It has given me the ability to search for answers, and it has made me a better person, and I think it will ultimately make me a better pharmacist as well. So, really, that's all I've got. So, thanks. Hopefully it wasn't too weird. Yeah. Okay, bye.